There are various kinds of insects in the world, which bite humans when approaching. You are likely to encounter many such insects in your life. Insects bite other creatures when they are stimulated or in danger. Insect bites can cause pain at first, but they can also cause the bite skin to have an allergic reaction to venom. Knowing how to identify insect bites can help you find the most appropriate treatment and be alert to possible dangerous situations. Learning how to accurately identify insect bites can help you quickly find the appropriate response. Part 1: Identifying common insect bites. 1. Identify where you have been bitten by an insect. Different insects live in different places, and in some specific environments, they are more likely to be bitten by certain insects. If you're biting outdoors or near the woods, it could be a mosquito, tick, or spider. If it's near food or trash, it could be a fly, bee, or wasp that bites you. If you're bitten while sitting somewhere indoors or playing with your pet, you may be biting fleas. In China, wild scorpions are mostly distributed in the provinces north of the Yangtze River, with Henan and Hebei provinces having the most. Scorpion stings are extremely painful and can be ruled out most of the time. If you are bitten by a fly-like creature in Yunnan, China, and it feels like you were bitten by a mosquito, then you may be spotted. If you are bitten while you are sleeping in bed, it may be bed bugs. If you are bitten on a sandy beach in the tropics, you may be bitten by sand fleas. 2. Check for itchy red packets. This is the most common appearance of insect bites and may be caused by a variety of insects, leading to different other symptoms. A single bite may come from a mosquito or a fly. You can see a tiny bite in the center of the mosquito bite packet. Flea bites can cause dense, itchy packets. The location may be where the clothes fit snugly to the body, such as the waist. Bed tick bites can form itchy red bumps, possibly with blisters, 2 to 3 lined up. 3. Check for swelling. Other types of insect bites can cause swelling of the surrounding skin. Fire ant bites can cause swelling up to about 1 centimeter and be filled with pus. Blistering may occur after a few days. Scorpion stings can cause swelling and redness, pain, or numbness of the skin. It is very dangerous and can cause severe symptoms in most people. If you suspect a scorpion sting, call an emergency department or seek medical attention immediately. 4. Check for bees and wasp stings. The stings of these insects can immediately cause severe or burning pain and swelling. They leave red scars similar to mosquito bites, and a small white spot where the bee needle pierces the skin. Bee and wasp stings may also swell the bite. If the sting is a bee, their bees are left on the skin. If stung by a bee, remove the bee needle. Bees die when they sting, because the needles are pulled out of them. You should not leave the bee needle on the wound and use a credit card to scrape it off. If you try to remove the bee needle with tweezers, you may accidentally make it deeper. No other sting insects, including wasps, mud bees and wasps, leave their bees. If you are stinged and no bee needles are left, then it may be these insects that sting you. They can sting people multiple times in a row. 5. Check if it is a tick. The skin is usually bright red after a tick bite, but there is no pain, so if you don't see it, you may not notice it. When you find a bite, ticks may still be on you. Most tick bites are harmless, but many ticks carry dangerous diseases such as Lyme disease and Rocky Mountain spotted fever. You should pay more attention when you find tick bites. If ticks are still on you, you should remove them as soon as possible. Hold the tick near the head with a pair of tweezers and pull it out. Do not rotate it to avoid separation of the head of the tick. Do not leave any part of its head or body. Tweezers should be used when removing ticks. Do not use Vaseline, matches or nail polish removers. If you can't remove the tick's head, it may be because it penetrates into the skin. If this happens, see your doctor right away, and your doctor should be able to help you remove the tick head. Pay attention to the bite. A bullseye rash, erythema, is a symptom of Lyme disease. If you see it, seek medical attention immediately. After spending time outdoors in the woods or through tall grass, be sure to check if you have been bitten by a tick. Ticks like warm, dark environments, so be sure to check your entire body. They may be as small as appeared in the article, so you can check with a magnifying glass. Tick paralysis is a rare disease, which is temporary paralysis caused by the release of neurotoxins by female ticks. Symptoms usually disappear immediately after tick removal, and are common in pets and children under 10 years of age. 6. Check for head lice bites. Head lice usually appear on the neck, scalp, and behind the ears. The bite marks look like a rash on the head. You may find head lice and its eggs in your hair. If you have head lice, you may need to wash your hair with an over-the-counter lice shampoo and wash any clothing and bedding that have come in contact with the head lice. Pregnant women should not use lice removal shampoo. You should consult your doctor about the best way to get rid of lice. For women who are unable to use chemical products, a coconut oil sleeping mask is usually available. 7. Eliminate severe spider bites. Spider bites are slightly different from insect bites and should be treated differently. Note 1 or 2 bite with 2 small holes, and a bite that is blue or purple, and starts to darken and painful. The former is the bite of a black widow spider and the latter is the bite of a brown spider. Seek medical attention if such signs are found. Other less severe spider bites may be similar to insect bites. A black widow spider's bite may cause stinging or no pain. Look for bite marks, tenderness, and swelling at the site of the bite. Symptoms that require attention include muscle spasms, nausea, vomiting, and even seizures. The bite area may become infected and swell with purulence. 8. Look for insects that bit you. Most insect bites cause pain, which you notice immediately. If you feel you have been bitten, try to find the insect that bit you. Take a picture, or if the insect is dead, pack the carcass. This will help you and your doctor determine what insects are biting you and determine what to do next. If insects are still alive, don't try to catch them. Otherwise, you will most likely be bitten again. If the insect dies, wrap it with transparent glue, being careful not to damage its body. This way you can show it to the doctor. Part 2: Treating insect bites. 1. Clean the bite area with soap and water. This keeps the bite area clean and prevents further infection. It is best not to use other ointments or medications until the area is cleaned. 2. If the bite area is itchy, use an antipruritic cream. Look for over-the-counter antihistamines like benazone or clotmetin. Do not scratch the wound as this may cause infection. Topical creams, gels, and lotions may help control itching, especially creams, gels, and lotions containing procaine or benadryl. 3. Swelling. Put a towel soaked in cold water or ice on the swollen area for cold compresses. If possible, raise the bite area to reduce blood flow. 4. Treat pimples, urticaria. The bulging and itchy red bumps may be allergies caused by insect bites, usually after fleas, mosquitoes and bed bugs. Urticaria can be treated with antihistamines and topical steroids. Do not scratch these lumps, as they may leave scars or cause infections. 5. Treat shock. Some insect bites can cause allergic reactions and are very dangerous. The first symptoms of a severe reaction are usually urticaria, rash, swelling of the throat or tongue, and difficulty breathing. This is a medical emergency, so call 120 or send to an emergency department as soon as possible. If you have an adrenaline syringe, you can use it because anaphylactic shock is life-threatening. 6. Seek medical treatment. In most cases, symptoms such as itching and swelling quickly disappear. If symptoms persist or worsen, you should see your doctor to make sure you don't have a more serious reaction. If you think you have been stung by a scorpion or are sure to do so, seek medical attention immediately. 7. Pay attention to the symptoms of other diseases. Insect bites may not be dangerous in themselves, but many insects can spread disease. Ticks can carry Lyme disease and Rocky Mountain spotted fever virus, and mosquitoes can carry West Nile virus and encephalitis virus, which can spread these serious diseases to humans. Watch for other symptoms such as fever, physical pain, and nausea. These symptoms usually indicate a more serious illness.